So I'm
Gonna
now going.
mute myself.
Okay, so we're going to look at this case that you've uploaded, which is 368. So we click onto here. And when we look at an uploaded case, if you've done and uploaded everything, I should be able to look at this. Now, I just can't see anything at the moment. What have we got here? We've got Nadir, tutor, reopen a ticket. Oh, that's a ticket. So it's not actually, that's a ticket. It's not actually a case. So I'm going to go back to Nadir again. And I'm going to look at it. That's create a ticket. Where am I at? We've got to go to his cases, which are up the top here. Manage cases, you know. And I go to manage cases, and then I'll see all your cases, right? Now we've got in this section, which I can see, we've got your cases that you've got consultation, and these are ongoing cases that you haven't quite completed yet. All right.
Yeah, one of them is gone. I don't know why it went there. I think by mistake I placed them there. But anyway.
Yeah. Okay, so we've got assignment ongoing cases. So we've got these two ones here. So which one of these would you like me to look at?
Do you want to look at the 368, which is the box up the top, the last one on the top box?
All right, so it's 368. This one here.
That's it.
So it's one of your ongoing ones. All right. Now we'll click onto that. So if I click onto that case, and what you will see is as you go through and you've uploaded your data, what you will see is you will see all the green ticks, which means you've done the medical history, you've done the periodontal assessment, you've done the occlusal analysis, you've done the pain details, soft tissue, and you've done the dental charting. So they're all in the case, yeah? Now we go down to the next section, which is the logbook section, the locker box. Now this is where you upload all the pictures and things about your case, where you manage the pictures. Now we can look at those pictures by looking at the documentation now. And basically we've got here contemporaneous notes, which you've written down. Now that can be just a cut and paste from your own records if you want. All right, yeah. Which you've done there. So you've got that information. The next bit you've got is you've got the consent area. Now the consent area is more about your diagnosis, because the clinical notes don't really go into any detail about diagnosis, what your treatment plan was. And in a consent, the bit that you give to the patient, which is your presenting position, is basically what you've discovered when you've seen the patient, your examination, what your findings are. So missing upper right second premolar, upper right first molar, and second molars, right? So you've got missing there, but I'd like to see just a bit more information there. That's a bit basic. Like you might say whether there's any over eruption, whether the space has closed up, the width of the ridge. Just a quick mention on oral hygiene. I know you've done BP and all those sort of things, but this is where you bring that data together, because you've got that data recorded, but you haven't actually distilled it or summarized it into what the presentation is. So you'll say narrow ridge, good vertical height of bone. If the patient's got TMJ history, you might put in there why the patient lost the teeth, you know, and also what problems the patient's experiencing. You know, they're finding it difficult to eat, this sort of thing. So build up, that is your patient's presenting position, and that's what you'll be putting in your consent letter. That's why they're coming along to have the implants done. Because you don't want somebody saying, oh, well, I had a missing tooth, but it never really bothered me. And this Mr. Nadir, he forced me to have an implant in that area. You know, he sold me the implant. So you've got to put there, the patient requested the implant. Always put the patient requested the implant in your consent information. They've asked for it. Remember, implant dentistry is elective. Now here we've got the actual next bit, this section here, we've got the proposed treatment. Well, that is your treatment plan. So your treatment plan is placement of 2 implants. These will be restored with a 3-unit metal ceramic bridge. again, give some idea of, how long it might take. If this is going to be a delayed case or an immediate case, these sort of things, just a bit more information. You don't have to write a book on it, but a bit more information there. The proposed treatment plan, which teeth are you actually going to be on this bridge? Well, the bridge is going to be replacing the second premolar, the blah, 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 the first molar, blah, blah, blah. Yeah. I'm not sure from this whether this is there's an 8 present or whether this is like a free end saddle situation.
There is an 8 present.
There is an 8. And of course, from the occlusal analysis, is that 8 functional? Is there a lower 8 there? These are the sorts of things that you'd put in. So it's going to be a 3-unit bridge replacing these teeth, occluding against the lowers. It's a bounded bridge. The 8 is taking some. It's great if the 8 is in occlusion, and that's wonderful because it's going to mean that there's less weight on your bridge, isn't there? There's less weight being taken by the implants. But if there's no lower 8 or it's not in occlusion or with a 7 or something like that, it's not as nice a situation. So just build that all up a little bit, yeah?
Right? Sorry, Prof, may I ask one question, please?
Yeah, of course.
So if there's an option to offer a normal bridge, should we write down this into this proposal treatment plan?
If I would normally put that in the current situation.
The consent,
yeah, and under the consent, the current situation, I would just say something like there was an option for a bridge, which was discussed with the patient, and the patient declined it. So just get rid of it because sometimes you end up writing a whole treatment plan about a bridge that you're not intending to do. So it's just confusing everybody by putting it in your treatment plan. But you do need to mention perhaps that you had that conversation in the current situation
to the patient.
Yeah. So if you discussed the possibility of bridge, you said we discussed but the patient requested to have implants. It's always about the patient requesting to have the implants, and then you go into the thing. Don't put the proposed treatment. Don't put 3 or 4 proposed treatments. Just put the treatment that you're actually going to be doing, not any other options that you've given them or any. Put that into the current situation if it's necessary. But then try and make it very sort of minimal. Don't go into great big details, and certainly don't start saying mesial and distal and all these technical terms, especially in a consent letter, because you'll just confuse the life out of people, right? Now there's an option here that you don't need to upload anything, but you can upload any other supporting documentation. So maybe the case was a referral, or maybe if you've got another consent or any other document. We've got 3D planning, so you might have some shots, some screenshots of 3D planning or something on a piece of paper. You could upload that up. Then you've got your any instructions that you were given, and that would cover the whole of that section. Yeah. Okay. Now remember, when you want to go back again to the case, you don't go on the back thing, you just click this part here. Can you see this part here where you need to click your bits and pieces? Yeah. So now we go along and we have managed the images, right? Now up here is just a summary of what we've got. So we've got contemporaneous notes at the moment. We've written 665 words. The consent process is very minimal with 12 words, and another 12 words on the treatment planning, and the total score here is only 600 odd words in that section. So I'd be looking for more wordage in that section, which you can add to it. Then we're going to go to manage our image album, which is part of the locker box again, and you're going to click onto that. And here we're going to have the images that you've got here. You've got study model images. Now, if I click onto this study model image, first of all, it would be nice to have a few more images. I'm sure you've got more images on this case than this.
Probably, yeah.
Yeah, but it all looks much better if you're presenting this to actually have more. So what we have here is we've got an upper. It would be nice to show the teeth in occlusion if you can in an articulator or something like that. It would help with the occlusal analysis. We can now see a lot more what you've got there. I can close that down, and then I can also look at what the narrative you've put there. You see, you've just put study models with pilot guide. It's not really very descriptive narrative of what you've got there. All right. So what you've got is you've got here, you've got an upper, an upper model to start with. You've got a template, a surgical guide, and it's got 2 guides, and it's actually guiding in the 5 region and in the 6 region. Yeah, the upper right 5 and 6 region. It's a tooth supported template, not a mucosal supported one. Yeah, you've got a window there showing the fit to check the fit. And are you intending to do this as a flapless technique, or are you intending to raise the flap?
No, it was raise the flap. This is just like pilot guide for the pilot and size 2 drills.
Okay, so you're just going to raise the flap, and you're going to just use this to make 2 pilots, and then use the rest, then go freehand with the rest of it. So you'd say a pilot guide not intended to prepare the whole site. So just put a bit more writing about what you've got there. Yeah?
Okay.
And basically you're going to lift the flap and the rest of it. Now here you've got the first, on the X-ray section, you've got the CBCT that you use to plan it. Now this is very nice. You've done a nice screenshot. We can see the ridges there. Now, what would you say is the type of bone that you have here? What sort of type of bone have you got here?
It was about 4, like 3, 4.
3, 4. Now, how are we deciding that it's a type 4? What are we looking at on this picture?
The cortical plate. It's mainly cancellous bone, very thin cortical plates.
Okay, so that's the first thing you're going to put there. You're going to put the region you're in. You're going to put the upper whatever 4, 5 region, and you're going to say this is type 4 bone with a thin with the cortical plates are quite thin, but good trabecular bone, because it's not. It looks nice, but you know it's well trabecular bone. So you've got probably 25-75% ratio. So you've got a type 3 bone there. You've got a good height of bone, although I can't see any measurements on this, you know, like the width and the depth of the bone.
It's all, sorry, it's all in the 3D planning documents. It's all the measurements of the planning in there.
Yeah, so this is the sort of information to put in the narrative.
Right.
Okay, this is why you have the narrative there. Obviously, you're not going to, you could upload screenshots of the 3D planning as well. You've done it. It's a very nice case. It's a very well thought out case. Yes. And you're selling it short by not putting, because these logbooks are going to be your showcase. If anybody questions you, so the more you can, you know, present, the more thought and reflective you can show you've been, the better it's going to look. I know I can see this is a very nice case, so don't undersell it, because you deserve to sell it better than this will just let. I know you've done it, and you can just maybe put a few more pictures showing the planning, mention the sort of bone that you've got there, mention the sinuses are quite high, you've got good vertical height. Yeah, the sinuses are out the way. You might even, although you can't see it on this, but maybe on other views, I'm just seeing a bit of the bottom of the sinuses might be clear with no evidence of sinus infection or membrane thickening. And again, if you have a shot of that, that's nice to put in as well, that you've you've actually looked at that. Yeah. So these are the sort of things that you've actually written here. CV shows type 3-4 bone, thin cortical plates, mainly cancellous bone. Good. The bone is with posteriorly, however, the sufficient bone width height. Plan is to under prep the osteotomy to. That's great. That's all good stuff. And you know, it's showing that you're actually thinking about how you're going to prepare the bone, that you're not going to drill up through the full sequence because the bone is softer. So
Yes.
if you can go sling a few more dimensions in there, you've pretty well got that. You know, I'm happy. I'm happy with that. Now, the panoramic view. Let's have a look at the panoramic view. This is a standard 2D panoramic view. And again, we can now from this. First thing is we can see the sinuses are quite clear. Yeah.
Yes.
And also the cusps on the. I mean, you shouldn't say this from an OPG, but the cusps seem a little bit flattened off. That lower 6 seems heavily restored, and it might be worth just mentioning that might need a crown at some stage, just to show you've taken a long-term thought. It does look like the 8 is occluding from this anyway. However, the 8 is heavily restored. So another good advantage of having the implant bridge there is to sort of say, well, it's taking the weight off the 8. It might increase the longevity of the 8 in reducing the load. And the main thing from the OPG on this side, you can see the sinus looks lovely and healthy. Interestingly enough, sinus on the other side looks a bit, there's some thickening of the membrane there, isn't there? Yeah. So that doesn't look quite as good, but this side is good. The nasal cavity, it's there, but it's probably further back than the view shows. Also on here, put down the teeth that you can see. So we've got 8, 4, 3, 2, 1, 1. You know, do the teeth present, and make just a note of that, and make there's no caries, and a good bone level around the teeth.
May I ask one more question, please?
Yeah.
So as we can see, yesterday we spoke about like periimplantitis and periodontal disease. So in this case, I could see that the recession of the bone and some kind of periodontal disease. So is it worth Natir to mention this in here that he tried to stabilize the periodontal disease?
Well, the bone level looks reasonable.
Yeah, because the guy is like 70 something.
Okay, yeah.
And we haven't looked at the BPE on the case, have we? I don't know what the BPE is here, but we'll have a look at that in a minute. But it's always worth mentioning.
Periodontal disease, should we mention, Prof? Or
if there is any periodontal disease, mention it, and that should also be in the current situation. Patient presented with periodontal disease and mobile teeth. That would be part of your diagnosis at the start, wouldn't it?
Mm-hmm.
Yeah?
Prof. But ideally, I think if we are to mention that, it will be ideal to say if it's still active or it is stabilized.
Sorry, what was that? Sorry,
I said if we are to mention that the patient has periodontal disease, I think it would be wise to like talk about that it's been stabilized for some time.
Yeah.
Because
yeah, I mean, you're quite right. You have to put that it's the periodontal disease is being under maintenance and isn't active. You can put that sort of thing, and you can put that in the current proposal. And in the current situation, if it were a perio case, you would actually write down in that you have a history of periodontal disease, which you're now maintaining. Yes, but please be aware that it can reoccur if you don't keep up with the maintenance regime. Yeah.
Okay.
And then you put that in your consent letter, and that's the beauty of doing the full assessment at the beginning, because you can put that in and it'll help you with your consent letter. So here we've got Nadir's written here, reflects bone was soft. I had to under-prepare osteotomy. I managed good primary stability. The upper right 5 implant wound up to be a bit close to the 4. I think you're being a bit hard on yourself. You've got
No, it's okay.
It can be 1.5. It looks like you're just over. It looks like you're almost like 2. So I don't think we need to worry about that one. But you can. So I'd get rid of that bit. Wound up to be a bit, because the thing is, you planned it, didn't you?
That's right. Yeah.
So the thing is, you can't then turn around and say it's too close because you actually had the benefit of planning it. If you did it freehand, but you know, planning it. But I think that looks nice. They're nicely parallel. You know, good implants. Upper 5 wound up being a bit too close. Pilot bird guide was used. This could be due to either some displacement. I don't think you had any of that. I think you're all okay. You can delete that.
Right.
The implant was perfectly, yeah, the implants were in good place, parallel. They were restorable. I mean, this was planned for screw retained, wasn't it?
That's right. Yeah.
So you need to mention that in the restoration somewhere. And here you've got periapical radiograph of implants and bridge. Radiographs was taken the day of fitting. Radiographs show good fit with no gaps. So there we are. Let's have a look at that. That's all seemed quite good and reasonable. Yeah, it looks a very nice restorative result.
Yeah.
No gaps, really well done. So, you know, that's a nice case.
And may I ask Natir what kind of implant did he use?
It's Neodent
Neodent?
from Straumann. Yeah.
Neodent, yeah?
Yeah.
Yeah.
Right. So we've got a clinical photograph of missing teeth, and then we've got the teeth there. And if I look at the photograph, let's see what we've got. Now, this is often where people sort of cancel that. They underanalyze things, maybe. And the first thing I would be doing is, what is the biotype of that tissue?
It's thin.
Thick.
Thick, yeah.
Which is biotype 2.
2, yeah.
And that's what you'd expect in a granddad.
Yeah.
How old did you say he was? 70 something?
He was born in 47, so it's like 76 right now.
Yeah. Well, I've got to be careful because he's only 10 years older than me, so I've got to be careful. So
I thought you're 56, Prof.
Pardon?
I thought you're 56.
Oh, I wish I was.
Prof, everyone says that you look way younger than you are.
Yeah, thank you for that.
Yeah. Like everyone who met you, they didn't give you that age.
I'm that decrepit, I know. Anyway, but you've got recession there, haven't we, guys? We've got recession on the floor, but no mobility. So that make that point. No over eruption of the teeth. Yeah. We can see the 8 is looking a bit shy back there, a bit stained up, but it's occluding. That we've got some wear on the teeth, which is expected. What do we think about the oral hygiene?
Fair.
Good, fair, moderate, poor.
Fair.
Could be better. It's
Fair, I would say.
Pardon?
Fair, I think.
Fair.
Fair. All right, so fair. So just put some mentions in about that. Yeah.
Okay.
I mean, somebody might turn around and say, no, I think if it was a hygienist, there's no way that'd be fair. You know, these people, they see one spot of plaque using a magnifying glass at 10 million thing. The patient's sent away with that, like that. Yeah. So these women are obsessed with plaque. All right. Now we've got, what are we seeing here? Nice wide ridge. We've got good high cusp angles on that. I would be thinking we might have a bit of premolar guidance there, but you'll know better than me what's going on. When you did the occlusal analysis, obviously the only teeth that are going to be in contact on the working side are going to be these. Yeah. Okay. Right. What did we put down there? Occlusal view, missing teeth. Yeah, you see it's a little bit sparse, isn't it?
Okay.
So need to work on that one. What's this one? Right, you see, that's a nice transfer impression, that window tray technique, I'm presuming. Yes?
Yeah, that's right.
So you did a window tray technique. What have we written here? Upper putty wash with impression copings, open tray technique. I don't think you can add much more to that. Here we've got the final job, looking nice. Again,
very nice.
Thanks. Thank you.
I'd still be a bit concerned about the perio. it looks like a bit red and inflamed. I think I would just say it's inflamed and you're sending him to the periodontist to
He does see the hygiene. He doesn't go to the periodontist, but he sees the hygiene.
hygiene. So just say he's going to be put on a stricter spit, you know. Okay. And then we're going to look at the occlusal view. Now, what you're going to do here, the nice thing to note here is we've got a narrow occlusal table, haven't we? A lovely narrow occlusal table there. Those teeth are no wider. Look at the natural molar on the other side. Look how much bigger it is than the premolars because it's got a bloody great palatal root. We haven't got a palatal root on our implants. So we have to keep the occlusal table no more than twice the diameter of your implant. So if you're using about 4 millimeter diameter implant, you don't really want this buccolingual dimension to be greater than about 8 or 9. Yeah. And if you draw a line from, let's say that what I do is draw a line from the platal or the cingulum here, right the way back to the cingulum on the other tooth, you see? And the teeth should all be within that line. Yeah, I wouldn't like to see one outside of that line. Does everybody understand what I'm saying? Draw a line across like that. You want all these teeth to be inside of that line. And sometimes you get jobs back and the thing's in the middle of the palate for some reason. Yeah, all right. So that's a very good. So you mentioned you've kept the occlusion, you've premolarized the occlusion. You've got a 5, 6, and a 7 there.
Yeah.
Restored. 6 is a pontic. Nice result. No cantilever, obviously, and you've got low cusp angles. There's not great big, apart from this one, but you've got low cusp angles.
Yeah,
which is acceptable. A nice result. A metal ceramic bridge, I'm presuming. Metal ceramic.
Right, yeah.
So mention all that there. Very nice picture here showing the final job. Very, very nicely taken picture.
Very nice, yeah.
Yeah.
Thank you.
So again, just mention metal ceramic screw retained bridge, which I'm sure you've probably written there. Yeah, metal ceramic type bridge, screw retained. Brilliant. So you've done everything there. If after you do this, you want to move your pictures around, you can use these little up and down arrows to just move the pictures up and down, right? So that's that bit of the whole thing done. We go back now from the picture box, or what I call, there we are, the album, the case album. And we go, and now we look at this piece here. Now the case is still ongoing because we perhaps haven't finished writing up all the data or things like that. So the time at which you complete it is when you've got everything done. Now we normally make this completed. We normally don't let it, I can't remember on this version of the program, but if you haven't put all the data in, it's not going to let you complete it. All right. So if it doesn't complete, it'll be because there's something missing, like those awful computer forms that we have to fill in. And, you missed something out, like you forgot to tick a box where you're going to give away all your life fortune or your kidneys, and you haven't clicked the box and it won't let you save the thing, right? Archive, no. Consultation date, we've got that down. You've got your case start date. We need to put a start date. Now, the start date will be the date at which you placed or did your first, whatever you did. It might not.
Well, I try to put it in there. It doesn't come up. It just disappears. Like if you try now, whatever date you put in there, once you click back, it goes. I don't know why.
I think you have to choose the format they've given you.
No,
so not to put it manually. You choose the year.
Whatever you go from this look. But the other thing we might do is that we did at one time to try and get people to upload their cases within a month. We did have a system in place where it wouldn't let you register it after it was a month old to try and make people.
Maybe that's what's happened.
Maybe that's what's happened. But when did you think you started this case?
Current pro. It was 2021 sometime, probably like a month or so after the consultation.
So probably you concentrate.
Just
So
say
probably
March.
March. So we say 1st of March.
Okay.
See, it's gone in. Can you see?
Right.
So I was
Now,
right. You choose the format.
Yeah.
I think that maybe that what it was. Yeah.
And then you've got the but if there's a problem, you can see I can do it for you. So just drop me a text and I'll do it for you. But I think it should be
Okay.
estimated completion date. Now, normally it takes about 6 months. So you'd be putting down probably sometime in September and done. So it's kept it, so they're done there. Yeah. That just gives you an idea of how you're performing. Was it,
Right.
did you overrun what you thought? Standard treatment, you're doing it independent. It was a male. You've got his date of birth. We can update the case. You're just updating it now. Fingers crossed. Going to accept all the data. Brilliant. Yeah. Now, we've got some bits missing here. We've got case reflection, diagnosis and treatment plan, case reflection, treatment outcome. So you need to just write up something in those areas.
So that they have to do that too, yeah?
Yes.
Oh my God.
On bad news, isn't it? But the thing is, if you have all this in and anybody ever questions your training, they cannot question what you've done, right?
Yeah.
And even if you reflect on it and you say, well, I could have done this better, like you're being a bit hard on yourself with the spacing, yeah?
Yeah.
It shows that you're reflecting, and what they want to see from practitioners now is reflection on what you're doing. Not just you doing it, but you're reflecting on it. And this is all. So case reflection, what was the treatment outcome? Well, it was not going to take you very much to write that, patient was very happy. It was planned to go that way. There were minimal problems. Right. I don't know. That's what I'm thinking. Case with self-appraisal. Is there anything you could have done better? Anything you would change? If you went back and redid this case, what would you do differently? Yeah? Perhaps you might reflect that you should have used the OsteoTie implant system instead of Straumann. That might be. I'm not putting ideas in your head there for no, for no unbiased reason. But you might just want to reflect, yeah? So they're just ideas to get. Now, the last thing is what we're doing here is we add the implant data here on this chart. And we can see that if I click on here, I can see all the information that you've entered on the implant. All right. And we'll look at a little bit closer detail on how that bit is done. All right. So that's that done. And we are now going to, we've got, so you've filled in all of these bits. So that's all good. Let's go and look at the options you have. We have got the medical history is done, the pain. So we just got the assignment and the case. So the assignment is the bit that you got to do. So because at the end of the day, all these boxes should be green. Yeah. Right. So you do your.
So what do you mean by assignment?
How do we do that?
The assignment is those bits.
Is the reflection and stuff,
yeah,
right?
Yeah. So I've clicked on the assignment box. And now you go submit case for assessment. So you're going to add your case assignment there. All right. So if we go, let me just go back again onto there. Go back. So this bit here, the red bits here, you haven't completed these reflections. And if you go to your options, they'll be here. So you go to case report. A second.
It's like a portfolio.
Right, there you look. You see, you've done your case. Oh, that's the case report that will print out at the end of the day. All right, when you finished, yeah. Okay, so that's good. And this is what will print out, and this is what we'll sign off that you've done your case report. So let me just go, because you can print it. You see, you can print it as a PDF.
Yeah.
Or maybe it doesn't give you that option, but we can print it and then we can send you the PDF if you want. and it has all this information is there in a nice, all the bits you've done, all the pain assessment, all the medical history, everything to do with that case is there.
It's okay. Just send me the diploma. I don't need the case report.
There we are. There's your charting as well.
Yeah.
All right. So it's you've got to do your this one here. We need to do that. We seem to have missed out something there. We've got assessment, aesthetic outcome. I think that's missing. So let's just go back and see what we've got there. Hold on. I mean, you could get the case report anyway. You just won't have the full bit that you could do, you see. So we can print out a case report on what you've done, and it looks very good on what you've done already. Yeah. But if you want to get it, and we can quite happily award you the diploma because you've done more than enough to get the diploma. But if you really want to shine at it and get a high mark, if you like,
right,
then making sure that all the sections are done, and it won't take very much work to actually.
Yeah, I'll do that. I'll go through them all over the next week or so, and I'll definitely do that. And maybe you can have another look in a couple of weeks.
Well, what we'll do here is I'll just go here. I need to go to the top again, and I go to edit this one. Right, so we're going back into the editing, right? So we've got manage your documents. So don't be frightened to click on all of these boxes, you see. So you've done all that bit there, but what you need to do is you've got these bits under here.
The reflections, yeah.
So these are the bits that you've missed. So you've got your consent, you've got your case reflection, right? Now it tells you can introduction. So you just write what the case is about. It was a 70-odd-year-old man, why he wanted it done. Some of it's seems repetitive. You're planning it with diagnosis and treatment plan. Just write down there that you diagnose missing teeth, wear on the teeth, gingivitis, well, you wouldn't say he had periodontal disease, or would you? I think he has got mild periodontal disease, but stable. It's not aggressive. Treatment outcome, and then your self-appraisal. And that's for you to decide. It's your self-appraisal.
So what do I write in the appraisal? Like what?
Well, basically, with your self-appraisal, what would you have done differently with this case? How do you feel the case went? Are you confident it had a good outcome? Was it the best outcome you could have got in the circumstances? Was there anything that didn't go particularly well about the case that you think you could have done better? I mean, it's a very good case.
Is that in the appraisal or in the reflection?
Well, a self-appraisal is a reflection, isn't it? You're reflecting on yourself. All of it's reflective, right? So you just click on there what you think, yeah?
Okay.
And then you update that, and you'll update all of these bits here. So you do an introduction. This is your case reflection. All this, and the case reflection consists of your introduction, your diagnosis and treatment plan, and your treatment outcome, and your self-appraisal, right?
Okay.
And then that gives you everything that you've shown you thought about the case. And then when you've clicked that and you've updated it, then you'll end up with all your little arrows going green. So, you don't have to write masses of it. Just sit down and think about it. All these little crosses will then go green, right?
Yeah, okay.
And then you can go to your options, and then you can click on case report if you want. And you might find that once all those boxes are green, you can click on completed. Yeah, but you see, it's telling you cannot complete this case until you have appraised all the sections, you see?
Okay.
Right? And it's telling you what you need to do to get on to complete that case. So it's guiding you through any missing documentation that you've got. Now you did do, if I go to your options, you've got the risk assessment one, you've got the dental chart. You've done soft tissue, pain, occlusal analysis, BP. Let's just see what you got for your BP. Right, so you've got a score of 6. Let's just have a look at that one. So 1, 1, 1. So they're all ones, weren't they?
Yeah, yeah. It's just a little bit of bleeding and a plug. The gum recession, I think it was age related. He hasn't got any like mobile teeth or forcations or anything.
Yeah, so that's good. So you've got that. So you've done the BPE, and we've got the occlusal analysis in there. So you've done all the. Basically, it's not a big deal to fill in the boxes and click the boxes. A case should take you about 2 hours to probably put a case up there and get it all done. You don't need to worry about the assignments as such. And then you've got your case report. Once you've got all this done, you can generate a case report. But you can do that anyway by just clicking that button, because you click that button and you have got enough to generate a case report if you want. So we're just going to go here. So this would be your case report. Yeah. You're just missing a few sections because so there'll be a few sections blank in your case.
Yeah.
And basically, there's also the competency assessment here, which you need to think about. Now, let's just see where the competency assessment is in here. As part of self-appraisal, yeah, is to be able to assess your own competency. And the more you look at your own competency, you know, the more critical maybe you'll become of what you're doing, and you'll be aware of the areas that you need to self-improve, because, you know, it's not really good enough to just have somebody like myself sit here and criticize you, because that's not fair, you know. Who am I to criticize you? It's for yourself to criticize what you're doing, yeah, not for anybody else to do it. So now, if we go here, we've got medical history, risk assessment. I'm just trying to find where we put the appraisal, the self-appraisal. There was a self-appraisal in here. Did you?
I think it was in the assignment box.
What do you think?
Yeah, it's assignment. Yeah,
it's in the assignment box.
Submit a case for assignment. No, it's not. It's not giving me a.
I think it has to be completed first, and then it goes into the bottom section where you can appraise it and things. It moves to the. If you complete it, then it will let you do the assignment and the appraisal. It looks like ongoing at the moment.
Yeah, let me just see what's happening. I've just submitted it for, so it's done that one, you see. Now, because you haven't finished all the sections, unfortunately, you failed. You've got 0.
Thanks.
Right, so sorry about that.
It's all right.
I'm going to write a letter to the GDC now.
See, it still says ongoing. That's what I meant. I tried to complete it a few times. It just goes back to ongoing.
Won't do, because you're missing certain things, you see.
That assignment bit, right?
Yeah. So risk assessment, we've got. You've done your risk assessment bit.
Yeah.
Here we are. Here we go. Right, this is what you're missing. So in the risk assessment bit, you've got medical status, right? So he was healthy, wasn't he?
Blood pressure, something like that. I think it was.
So pretty well, unless they've got something like cancer or diabetes or something like that.
No.
What was he smoking like? Was that all okay?
Yeah, it doesn't smoke.
Right. What was his? We've got here patient's ability to maintain their oral hygiene. Yeah, I think it's okay. Good.
Yes. Yeah, he was
moderate. I think moderate. Patient's expectations, I don't think they were very high. Not
I just wanted the teeth to chew.
Smile line, it's low and no importance. Oral hygiene, I'm going to put down that it was moderate. Yeah.
Yeah.
Restorative condition, few small restoration, moderately restored.
Moderately restored.
Periodontal condition, we would put no previous periodontal disease. You got all the PP are lower than 3. Yeah. Occlusal stability. Well, I think he's got a fairly intact. He's got probably slight tooth wear and guidance contact. We've got tooth alignment. Well, the teeth were fairly regular, and the center line seemed coincident. Interarch space was about greater than 12 millimeters. You had a big, distance between the teeth and the ridge. Teeth were firm. The integrity of the dentition. One tooth, multiple teeth were missing.
Yeah.
Reason for tooth loss was why did he lose the teeth?
I think he had root fillings and caries.
Okay. So basically, recent loss less than 4 months, tooth loss within 2 years, tooth missing for several years. Yeah.
I think 2 years, probably within 2 years.
Yeah. Okay.
It was.
That done. Then we go to anatomy. No anatomical structures in the vicinity to worry about. We were happy, we're good with that. Bone quality, adequate bone, sufficient to allow 2 millimeter border around the implants. Yes.
Yes.
Site history. There was no previous implant placement. Requirements here. Augmentation. There was none needed. Placement protocol would be a delayed. Yep.
Yeah.
Loading protocol would be delayed as well. Bone level placement, you did that. Delayed, what's this? None. Please, implant positioning, anterior canine and first premolars, sort of like that one.
Yeah.
Design of the prosthesis. And we click on the arrow and you've got a single small posterior bridge supported by 2 to 3 implants. That's the one. And what we've got last one is implant material was metal ceramic, wasn't it?
That's right.
So fracture resistant components, multiple repairs. What's this? Oh, it's the history. I'm on the history. Sorry, the history bit. Nothing. Implant repair since the last visit. No previous history. There we are. Update that. Right. Now you see, now that you've filled in that risk assessment, we can read what it says up here. Yeah. Now, you've got the maintenance index. That's how much maintenance you have to give it. So you've got a score of 13 to 20. You've got a score of 20. That's the range you're in. The maintenance risk index calculator assesses the maintenance requirements for implant patients to help prevent peri-implant disease and prolong implant survival and success for the prosthesis. A risk-based examination should be carried out on all implants, on all prospective implant patients, and again, following completion and installation, patients must understand the specific risk factors and how they will influence their consent process. Because if you don't point out the risks, then how can you get a good consent? So the score is 20 maintenance. So maintenance interval is 12 to 16 months. Restorative outcome, very stable and resistant to peri-implant disease. This is dependent on patient maintaining a good level of oral hygiene and maintaining good health. And prosthetic maintenance would be expected within 8 to 12 years. You might need to do some work on that bridge. So would anybody disagree with that analysis?
No.
No. Seems quite reasonable, doesn't it? Yeah. But see how the algorithm has worked it out for you. Yeah. Now, treatment risk index. This is how complicated the thing is going to be. So obviously, if you're not very experienced and you get a high risk in terms of technically challenging for a number of reasons, you should run away and not do it or give it to somebody more experienced or somebody that likes taking higher risks. Yeah. So the treatment risk index is medium. So treatment risk calculator assesses the risk associated with providing implant treatment and is used to determine outcome and its vital components for understanding valid consent. It also helps dentists to self-determine their own competency. So, restorative outcome, less predictable, with possible occasional slight complications. Expect slight delays in completion. The treatment requires an experienced practitioner who's placed at least 50 implants, and this is an advanced type of case. So would you agree that you've probably placed more than 50 implants and you're quite experienced?
Yeah, I have placed more than 100 actually. Yeah, definitely.
Exactly. And also, were there any technical setbacks or delays? I'm thinking in particular the fit of the framework. Did you have any prosthetic delays?
No, not really. Went all right.
Okay, good. That's brilliant. But with screw retained, they can be sometimes more challenging. Yeah.
Yes.
And I'm sure you've had some where you've had to send the framework back a few times. So that's why that's coming up there. And you're warning the patient when you do your consent letter, that's the sort of thing you'd put in. But they might expect some slight delays because it's a more complicated thing. Now, the aesthetic risk index, the score is a medium risk. It's 35 to 50. And your score was there. So the aesthetic risk calculates the possible aesthetic outcome of an implant treatment and is used to advise the patients, right? Acceptable outcome, advise patient they may have to accept some compromise in the soft tissue aesthetics, some reduction of papillary height, and an uneven gingival margins. Would you say that was correct?
I would say so, yeah.
Right. So you see how by filling in this little thing that I developed, we've anticipated mostly of what he's going to come out at. Yeah. So this is a nice thing to fill this in, because if you fill this in, it also helps you to complete the rest of the questions on the case, because it's making you reflect on it. Yeah. Okay.
That's right.
So we're going to update that, which I think we've done anyway. And then if we come out of that, now let's see what we have here. We go back to there, and hopefully we'll see a lot more tickies. Oh no, we're still missing. Oh, because you haven't done this, have you? Yeah. You still got to write your case reflection.
There's a reflection we still need to. Yeah, I still need to.
Then after you've done that, if I go to try and click it to complete it, you see it'll say you cannot complete this case until all the appraisal sections, all documents have been uploaded. Yeah. So once you've done that, which won't take you more than about 10 minutes, really. You don't have to write a great big essay on it. Away you go. And then we can do your case report, and we can print that off for you and sign it all off. All right. So I think so that's giving you a good idea, a good resume of that. Now I'm going to just stop.
So do you want me to